What are calcium-based phosphate binders for CKD? Imagine your kidneys are like filters that keep your body balanced, especially when it comes to minerals like phosphate. In chronic kidney disease, these filters don't work as well, so phosphate can build up in your blood. This excess phosphate is called hyperphosphatemia and can cause problems like bone disease and hardening of blood vessels. To help manage this, doctors often prescribe medications called calcium-based phosphate binders. These medicines work by attaching to the phosphate you eat or drink in your gut. When they bind to phosphate, they form a complex that your body can't absorb. Instead, this complex moves through your digestive system and is excreted in your stool. This process helps lower the amount of phosphate in your blood, which is very important for people with kidney disease. The most common calcium-based phosphate binders are calcium carbonate and calcium acetate. Doctors have used calcium carbonate since the 1980s because it is effective and affordable. Calcium acetate is also used and may be a bit stronger at lowering phosphate. However, it can sometimes cause higher calcium levels in your blood, which is called hypercalcemia. In people with chronic kidney disease, the kidneys struggle to remove phosphate, leading to mineral imbalances that can weaken bones and cause calcium deposits in blood vessels. Calcium-based binders help prevent these issues by controlling phosphate levels. Usually, they are used along with a special diet that limits phosphate intake, guided by a dietitian. But it's important to be aware of the risks. Taking too much calcium from these binders can lead to calcium overload. When calcium builds up in your blood, it can cause calcium to deposit in your blood vessels and soft tissues, leading to a condition called vascular calcification. This can increase the risk of heart problems, which is a serious concern for people with kidney disease. Research shows that while calcium-based binders are good at lowering phosphate, they might raise calcium levels too much in some cases. Non-calcium binders like sevelamer are also available and may have a lower risk of causing calcium buildup and blood vessel calcification. Doctors often weigh these options carefully, especially if a patient already has high calcium levels or signs of blood vessel calcification. For those living with kidney disease, managing phosphate levels is a key part of staying healthy. Calcium-based phosphate binders are helpful tools, but they need to be used carefully. Regular monitoring by healthcare professionals is essential to avoid side effects and ensure the best treatment plan. Patients should never change their medication without talking to their doctor because controlling phosphate is vital for protecting kidney health and preventing complications. In summary, calcium-based phosphate binders are effective medicines that help control excess phosphate in people with chronic kidney disease. They work by binding phosphate in the gut and preventing its absorption. However, because they can cause calcium overload and vascular calcification, their use must be carefully managed by healthcare providers. These medicines are part of a broader approach that includes diet and other treatments tailored to each person's needs. Always consult your healthcare team to find the safest and most effective way to manage your condition.